So I think some of the key issues and answers that we have in cardiovascular disease around primary care is a real risk that we're going to start to see the reverse of the reduction in CVD mortality. So a lot of people have thought that cardiovascular disease has been done and dealt with, but actually there's a real risk now that we start to see mortality increase, but primary care is going to be really important in correcting this issue.
I think probably the key issue we're going to have to deal with over the coming few years is prevention. And that's not something we do very well in general practice, but I think we'll be greatly helped by things like digital tools and the NHS Health Check. But I think in particular, as GPs and nurses, we've got to get a lot smarter at improving detection and management of high-risk conditions like blood pressure and atrial fibrillation. Despite having an excellent primary care system, actually we don't manage to offer the right treatment to about half of all people with long-term conditions.
So I think primary care really is the answer to these challenges we have. I think the way that we need to prepare is how we utilise data better. How do we understand the care that our patients are receiving, and that we get a lot better at scrutinising and looking at that data. So if I'm working in a practice in Manchester, for example, is my care better, indifferent or worse than somewhere else? And when we identify where we need to improve, that we start to develop strategies for improving that care.
The first thing that's really important is intelligence, is actually auditing what we do so that we know in real time on a day-to-day basis how many people have undiagnosed or undertreated conditions. Probably the most important thing is that we need high quality leadership that identifies this is a problem we want to sort out, this is a problem for us as clinicians, we own this problem and we want to find solutions. I think that has to be a starting point for improvement.
So Public Health England and NHS England are really now focusing in on CVD as being a really important prevention priority. We have the NHS Prevention Board now advocating that this has to be a priority for our whole health and care system. So there's lots of things going on in Public Health England. We've launched the new Heart Age tool. So how do we go direct to members of the public so they understand their own risk, versus how do we also support our health and care professionals in getting better and delivering care to the most optimal way we can?